Okay, we are sitting here with Lieutenant Governor Bill Halter, who's just had lunch with his lovely wife, Shanti. Shanti, you can say hello to.
Hi.
And who is an attorney who telecommutes to California. She specializes in water issues, and we need more attorneys who specialize in water issues for drought-stricken California. Anyhow, that's the Lieutenant Governor's wife, and we're here with Bill Halter, who I have to say has been absolutely critical to the success of this enterprise. And I'd like to ask you something. What made you get, pull out the stops to make this happen?
Well, we saw the appeal that the National Association of Free Clinics and Keith Olbermann made to have a clinic in Little Rock. And of course, I was very well aware that 450,000 Arkansans are currently without health insurance. And it struck me that this would be a great opportunity to get health care for some folks who weren't being appropriately served. And so we reached out, helped them to get the venue, and then reached out and also to the different organizations and groups around Central Arkansas who touch healthcare and got them involved as well. So the Doctors Association, the Nurses Association, all the major hospitals in the area, church groups, the Association of Free Clinics and the free clinics in the area, as well as other government agencies. And all these folks came together very quickly and very well, worked hard, decided that we wanted to make this a completely nonpartisan event focused on healthcare delivery. I'm extraordinarily proud of my fellow Arkansans. In just a few short weeks, over 1,200 Arkansans volunteered to come here and to be part of this and to help provide medical care to more than 1,500 of their fellow Arkansans. It's a wonderful outpouring from them, and I'm very grateful to them.
Yeah, and I want to say, on behalf of Governor Halter again, that he's been doing a lot of interviews and people are asking him a variety of political questions, and he's very careful to say this is a nonpartisan event and he wants to keep it that way, and he's really focusing on the dire need for health care. But unfortunately, the issue of health care is a political issue, and I'd like you to just tell us what you're hoping will happen tonight in Washington when the Senate votes on the cloture amendment bill.
Well, I think we now know. In fact, we just heard that the cloture vote is going to be held, and that the cloture will be achieved. There will be 60 votes for cloture, and that the debate will proceed. And I think that is, a minimal first step. Obviously, it's an important first step, but it's a pretty low hurdle to clear that you actually get agreement to debate a bill and amend a bill on the floor of the Senate.
Right, I agree with you, and I will ask you, as we were just discussing, that Arkansas ranks quite low in the pecking order according to the Commonwealth Fund. They're 48, and despite the best efforts of people like you can't bring Arkansas into the 21st century in terms of health care by yourself. So I want to ask you, what would happen to a state like Arkansas if we don't get really good health care legislation with a good public option? Tell us predict a...
Yeah, I think we've got an opportunity here to do something that, we get opportunities to address health care in a modest way in every session of the Congress, but we don't get these opportunities to address health care reform in a comprehensive way, but about, once in a generation. Last time was 1994 when a president from my home state, worked on it and worked very hard on it. But we didn't get the opportunity to improve health care that we wanted. Here in the state, we have 450,000 Arkansans that today don't have health insurance. That is, very much in line with the national figure of 45 million plus Americans that don't have health insurance. So this is an important opportunity. Now, I believe that we get these shots only once in a great while. We do have now a Democratic president and a solidly Democratic Congress. You would hope that this could be done on a bipartisan basis, but if it can't be done on a bipartisan basis, it still needs to be done. So my view is, we've got a great opportunity here. It needs to be something that we get done this time.